Hi, I'm Dr. Jackie Garrett with Agape Allergy Immunology Associates. Thank you so much for joining us today.
What is anaphylaxis?
Anaphylaxis is a severe allergic reaction that happens to exposures to your allergens. They can be foods, environmental, and what we're going to be focusing on today is bee venom specifically.
Can someone anaphylax with their first bee sting?
It is exceedingly rare for someone to anaphylax with their first bee sting. The rate is about 0.1 to 0.3% as far as anaphylaxis goes. Generally, what happens is you would have been sensitized, which means you would have been exposed to a bee sting. Maybe you don't remember in early childhood, and your body remembers that and makes allergy cells for it. There are individuals who have other diagnoses like mast cell activation syndrome or systemic mastocytosis, which means their allergy cells are overactive essentially, and with exposures to common allergens like bee venom or insect venom, they can anaphylax, but again, exceedingly rare. Generally, you've been exposed in some way, shape, or form prior.
How do you treat anaphylaxis?
Epinephrine, that is your best friend. So generally, EpiPens is what everybody knows. So for those of you who have EpiPens, there should be a trainer that looks like this that comes with it. There are generic versions of epinephrine that look like this. There is a talking epinephrine device that looks like this. There is also now an inhaled epinephrine device that looks like this. So anaphylaxis, severe allergic reaction, must be treated with epinephrine. Antihistamine, so people are like, oh, they're having a bad allergic reaction, I'm going to give them Benadryl, or if you have Zyrtec, I'm going to give them Zyrtec. They do not help with anaphylaxis. They will not stop anaphylaxis. A mild allergic reaction, absolutely, but they will not help with a severe allergic reaction. So if somebody starts off with a mild reaction and progresses, that antihistamine is not going to help. They truly do need epinephrine. And no, antihistamines do not mask the symptoms of anaphylaxis. If you're going to anaphylaxis, it's going to happen through Benadryl and all of that.
What can you do if someone you know anaphylaxis is in front of you?
Call 911. If you're in the US, call 911. Call for help, call for emergency. If you happen to have an epinephrine device with you, even if it's your own epinephrine device, just double check with your friend, your loved one, that they're okay with you using your device. Please go ahead and do so. But the biggest thing to do is call for help if you're not prepared to treat them. And also remember, the epinephrine devices come with buddies for a reason, because you can administer one device, and if they're no better in about 3 to 5 minutes, the buddy comes into play. So try to keep your epinephrine devices together at all times. So just in case, if you happen to be in a situation where there's a severe allergic reaction, that you're ready to treat yourself or someone else. If you've had bee sting allergies in the past and haven't seen an allergist, I strongly recommend that you check in. The management of bee sting allergies has changed, including allergy shots for it, to just help decrease that risk of anaphylaxis to less than 3%. So check in with your allergist, or check in with your primary care or your family practitioner to see an allergist, so that you're prepared for this season. Thank you for taking the time to hear me out for today. If you have any questions, please call Agape Allergy and Immunology Associates, 413-707-7720, or send us a message in the portal. I hope this was helpful to you and your family.